The future of dermatology is being shaped today. Aesthetic and regenerative dermatology are advancing rapidly. New technology, new therapies, and new scientific discoveries are transforming how we care for the patient. As the Indonesian Society of Dermatology and Venereology, we believe that progress must always be guided by science, ethics, and responsible medical practice. That is why we established Aruna Summit 2026, a scientific platform designed to connect dermatologists, researchers, and innovators across our region. We invite you to join us at Aruna Summit 2026 in Jakarta and be part of this shared vision.
When we start designing Aruna, we ask one simple question: what should the future of aesthetic dermatology looks like? Today, our field is evolving rapidly with new technologies, regenerative therapies, and expanding possibilities in aesthetic medicine. As innovation grows, one principle must remain clear: aesthetic dermatology must remain inclusive, evidence-based, and appropriate for all skin types and colors. Indonesia reflects this diversity, with patients across all skin of colors. That's why the theme of Aruna is Global Aesthetic for Skin of All Colors. We want to create a platform where dermatologists can exchange knowledge, share clinical experience, and advance treatments that are safe and relevant with diverse populations. We look forward to welcome you to Aruna Summit 2026 in Jakarta as we explore the future of aesthetic dermatology together.
from Interbat Aesthetic. The first was Ionic skincare system.
Good evening and greetings to all of us. To our honored distinguished professor, esteemed speaker, moderators, panelists, and fellow physicians attending the webinar, welcome to the Aruna 2026 pre-event webinar with the topic, The New Era of Regenerative Aesthetics from Native Collagen Biostimulation to Skin Resilience. Allow me to introduce myself. I am Dr. Andina, and I will be your master of ceremony for tonight's event. Thank you to all college for joining us this evening. This webinar is the final part of pre-event webinar series leading up to the Aruna International Summit 2026, which will be held on September 4 to 6, 2026 in Jakarta. Tonight's Aruna 2026 pre-event webinar is organized in collaboration with INSDV and proudly supported by Interbat Aesthetic. We sincerely appreciate their support in making this event possible. So before we begin tonight's scientific sessions, we'd like to share a few important updates from Aruna International Summit. Registration for this webinar with SKP was fully booked within just one day. For college who were unable to secure a Zoom seat, don't worry, you can still join and watch the webinar live through the Perdoski official YouTube channel. We would like also to inform all participants regarding the regulations for the Pelataran Sehat, LMS, and SKP learning credits. The pretest access will be available starting from today, July 6 at 5 minutes past midnight until 6:34 p.m. The post-test access will be available starting from today at 10:05 p.m. until Thursday, 9th July at 11:59 p.m. We would like to emphasize that the access period for both the pre-test and post-test cannot be extended. Participants who do not complete the pre-test will not be able to access the subsequent learning modules as the system will be automatically locked. So consequently, they will not be eligible to receive the SKP learning credits. Therefore, we kindly remind all participants to complete each required step within the designated time frame. So this year, Aruna carries the theme Beyond Borders, Beneath the Skin, Global Aesthetic of Skin of All Color. Aruna will feature more than 80 national and international speakers from 12 countries with an evidence-based scientific program, expert case panel discussions, and a focus on skin of color. Also workshop, hands-on training, the next gen stage, as well as various networking opportunities with experts in the field of aesthetic dermatology. For more information and registration, please visit www.arunaSummit.id or follow @aruna.summit. Tonight, we also have several exciting rewards for our participants. There are 3 premium skincare packages from Interbat Aesthetics, each worth 1.5 million Indonesian rupiah. The prizes will be awarded to each one lucky participants who giving questions during the Zoom webinar and also through the YouTube live chat, and one participant who shared their experience about the webinar on Instagram. So stay active throughout the session, participate in the discussion, and don't forget to share your experience on social media. You might be one of tonight's lucky winner. Tonight, we are also pleased to offer a variety of exclusive privileges for webinar participants. For Indonesian participants, we have an exclusive Indonesian registrants offer available only from 6 to 9 July. We have special offer for the symposium registration and also workshop by using promo code. For international participants, Aruna also offering an international registration fee waiver up to $500. This recognition will be awarded to 5 lucky questioners and 5 lucky participants who share an Instagram story. Please note that recipients are required to submit and present an oral or poster presentation at the Aruna Next Gen stage, and the submission deadline is 15 July. And also for international participants, we also opening a call for abstracts. For free registration to participate, please submit your abstract by email to scientific@arunaSummit.id, and the submission deadline is 15 July. So don't miss these exciting opportunities. Before we begin, allow me to briefly remind all participants that the webinar will be conducted in 2 sessions. The first one, there will be 3 speakers. The first speaker is Dr. Ruri Diah Pamela, who will be talking about ethics in regenerative aesthetics and about exposome. The second speaker is Professor Dr. Reifa Farah Diwiana, who will be talking about skin gravity and the role of ionic technology in barrier and skin resilience. The third speaker is Dr. Stanley Setiawan, who will be talking about biostimulation and the role of native type 1 collagen in regenerative aesthetic medicine. The second session will be case presentation by Dr. Jonathan and Dr. Clinton, and each session will be followed by a live panel Q&A. We encourage everyone to actively participate by submitting questions through the Q&A box or chat box, also from the YouTube live chat. Now, to officially open tonight's webinar, it is my honor to invite Dr. Hani Nilasari, SPDVE, as the President of INSDV, to deliver the opening speech. Dr. Hani, the screen is yours.
Thank you, Dr. Andina Bulansari. Good evening, distinguished speaker, respected colleague, and dear participant. First, let me show my deepest gratitude to President of Aruna International Summit 2026, Dr. Danang Triwahyudi, FINSDV, FRDV. And also distinguished speaker, moderator and panelist, Professor Dr. Reifa Farah Diwiana, SPDVE, Subspecialist DI, MCAS, FINSDV, FRDV, Dr. Stanley Setiawan, SPDVE, FINSDV, FRDV, Dr. Ruri Diah Pamela, SPDVE, FINSDV, FRDV, Dr. Jonathan Subekti, Bachelor Maths Science, SPDVE, FINSDV, and also Dr. FX Clinton, SPDVE. Honored Professor, respected senior colleague, and fellow professional. All of the organizer committee members and Interbat as our sponsor partner for today's webinar. And also participants present here who contributed and took a big role in this activity. It is my great pleasure to welcome you, all of you, to Aruna and Interbat, the new era of regenerative aesthetic, from the native collagen biostimulation to skin resilience. As a president of the Indonesian Society of Dermatology and Venereology, or INSDV, I am proud to see the scientific collaboration taking place as a part of our journey toward Aruna International Summit 2026. As dermatology continues to evolve rapidly, we are challenges to not only to keep
Okay, thank you, Dr. Hani, for the warm and inspiring opening remarks. Next, we have Dr. Danang Triwahyudi, SPDVE, as the President of Aruna, to deliver his greetings to all the faculty and participants. Dr. Danang, the screen is yours.
Yes. Thank you, Dr. Andina. Good evening, everybody. Yeah. So, good evening, distinguished speaker, respected college, and dear participant. First, let me show my deepest gratitude and acknowledgement to our President of the Indonesian Society of Dermatology and Venerology, Dr. Hani Nilasari, and also our distinguished speakers, moderator, and panelists, Professor Reva Farah, Dr. Stanley Setiawan, Dr. Ruri Diah Pamela, Dr. Jonathan Subekti, Dr. FX Clinton, and also our MC, Dr. Andina Bulansari. Honored Professor, respected senior college and fellow professionals. And also all of the organizers, the committee member, and Interbot is our partners for today's webinar. And the participants that are present here who contributed and took a big role in this activity. It is my great pleasure to welcome all of you today in this webinar to prevent Aruna, the last one, with the theme, The New Era of Regenerative Aesthetic, from Native Collagen Biostimulation to Skin Resilience. As we prepare for the Road of Aruna International Summit, this pre-event webinar series serves as an important platform to share current evidence, exchange clinical experience, and also strengthen academic connections among dermatologists and healthcare professionals. We believe that every scientific discussion brings us one step closer to delivering better, safer, and more evidence-based care for our patients. Today's topic highlights an area that continues to evolve rapidly in dermatology, where scientific advances and clinical experience work hand in hand to improve patients' outcomes. As dermatologists, we are constantly challenged to translate emerging evidence into practical, patient-centered care. And also through today's discussion, I hope that we will get not only updated scientific knowledge, but also valuable clinical insight that can be readily applied in our daily practice. We are also privileged to have distinguished experts with us today who will share their valuable knowledge and clinical insight. I sincerely thanks to all speakers and moderators for contributing the time and their expertise. I would like also to thank Interbot for their valued support in making today's webinar possible. We truly appreciate this collaboration and their commitment to advancing scientific education in dermatology. Finally, my sincere thanks go to everyone that has contributing to organizing this webinar. Your dedication and support have made today's event possible, and I encourage all participants to actively engage in today's discussion and make the most of this learning opportunity. I hope today's webinar reflects the spirit of Aruna by bringing together all the experts, sharing evidence, and also building meaningful collaboration that inspire innovations and elevate the quality of dermatology care across the regions. I wish all of you the productive, insightful, and also enjoyable scientific session. Thank you very much.
Thank you, Dr. Danang, for the remarks given. Next, before we move on to the scientific sessions, we would take picture first. So to all the panelists, the moderator, and also the speaker, maybe you could open the camera first, and then we take a picture. The operator will help to guide us.
Okay, thank you, MC. Can you turn on your camera for the moment if possible? Please, you get ready. Feel free and to give your many smile for tonight. Okay, and we will take photo of you second, and everyone get ready. Please look at the camera and 3, 2, 1, smile. 3, 2, 1, smile. Maybe tagline tagline A for Aruna, maybe. Okay. Okay, and look at the camera and 3, 2, 1, smile. And 3, 2, 1. Okay, thank you.
Okay, thank you very much. So, ladies and gentlemen, now we will move into the scientific sessions to guide us through the night discussion. It is my pleasure to invite Dr. Ruri Diah Pamela, SPDVE, who will open and moderate the main session. Dr. Ruri is a distinguished Indonesian dermatologist. She is now the Chief Department of DVE, the General Sudirman National Defense Central Hospital, Jakarta. She has been a very active speaker both at national and international conference. To Dr. Ruri, please kindly take over the session.
Thank you, Dr. Andina, and good evening, everyone. My name is Dr. Ruri Pamela, and it's truly an honor to be moderating this first scientific session tonight. So we've just heard the warm opening from the leadership of INSDV and Aruna, and now it's time to dive into the science. So tonight's session is about a shift in a way we think about aesthetic medicine, moving from simply repairing skin to truly regenerating it. We will explore the ethics behind this new frontier, the science of exposome, the clinical parameters that define the skin quality, and how ionic technology and native collagen biostimulation are reshaping our treatment approach. So let's not waste any time. I'll begin with my own presentation. Then we will move straight into an incredible lineup of speakers. So please stay with us until the end because we will have a live Q&A and a case discussion room that I promise will be worth the wait. Allow me to share my screen. So let's start with a foundational question. As we push the boundaries of regenerative treatments, how do we make sure our practice stays grounded in ethics and evidence? That is exactly what I want to unpack in the next few minutes. So regenerative aesthetics is more than a trend. It represents a real shift from simply correcting signs of aging to actually restoring the skin's own biological functions. So we now work with biostimulation, exosome, and collagen induction. It's the technology that asks our own body to heal and renew itself. That is very powerful. But every innovation we bring into our practice is also a promise that we make to our patients. It's a promise of safety, honesty, and of course, it's a promise of trust. So here lies our biggest challenge. Innovation is moving quickly, sometimes faster than the evidence behind it. We hear bold promises, dramatic results, one product for everyone, and the word regenerative used as a marketing label. But what our patients truly deserve is what must be proven. Realistic timelines grounded in biology, the protocols that tailor to the individual, and claims that backed by a real peer-reviewed data. So that gap between the promise and the proof is exactly where our clinical judgment and our ethics must lead. So how do we close that gap? I believe it rests on three pillars. First, ethics, making honest, patient-centered decisions above all else. Second, the evidence, building our protocols on data, not just on the hype or the trend. And third, the professional responsibility. We need to stay accountable for our patients, our peers, and of course to our profession. These three pillars, these three pillars are what separate a true decisions from the passing trend. And let us start with ethics in practice. Informed consent actually is not just a signature on a form, it's an ongoing conversation. So it means explaining the biological mechanism in language our patients can truly understand. It means setting realistic timelines and expectations, never guaranteed. And it means disclosing risks, alternative, and any off-label use, clearly and honestly every single time. And being the early adopters of this new technology does not excuse us from being rigorous scientists. It means we demand real data before adopting to a new modality. It means we acknowledge honesty, what remains unknown or unproven. And it means we contribute back through publication, documentation, and sharing our outcomes with the wider community. And this is exactly the spirit behind today's scientific program. In closing, let us remember that regeneration is a privilege we offer to our patients, and it deserves the same rigor we ask to the science itself. The ethics, the evidence, and professional responsibility are not barriers to innovations. They are what make our innovation worthy of trust. So thank you for your attention. Now, I will continue to my second presentation. Allow me to share my screen.
Maybe you can, okay.
Should we stop here?
Maybe can you press escape button on your keyboard, doctor?
Oh, okay. Sorry.
Oh.
Um,
And will you start your slide again?
we will try this to share the screen again.
Yes.
Okay. Can you see my slide?
Yes, clear, perfect, Doctor.
Clear? Okay. Okay, should we stop here?
No, you can start slide for your presentation.
For the next presentation? Okay. Sorry. Can you see my slide?
Yes, clearly perfect, perfect, Doctor.
Okay. Should I finish this presentation or we shall skip? Okay. Okay, so now that we framed our ethical foundation, let's zoom out even further. My topic is building the skin integrity in the age of exposome. And I want to show you how this connects directly to our today's theme, from the native collagen biostimulation to skin resilience. Because before we talk about regenerating the skin, we need to understand what the skin is truly up against every single day. So the word exposome was introduced in 2005 by epidemiologist Christopher Wilde. His argument was simply but powerful at that time. The genetics alone cannot explain why disease develops. So then we also need to measure everything a person is exposed across an entire lifetime with the same scientific rigor that we apply to the genome. And dermatologists later adopted this idea for skin specifically because no other organ interfaces with the outside world as directly and continuously as skin does. In 2017, Johnny Krutman and colleagues published a landmark review mapping the skin aging exposome into 5 major domains: its solar radiation, air pollution, tobacco smoke, nutrition, and broader lifestyle factors such as stress, sleep, and even cosmetic use. And what's important clinically is that these factors don't act in isolation. They interact and often amplify one another, which is exactly why a single cause explanation for skin aging is no longer enough. So let's look at the real data. In the Salia cohort study, 400 women aged 70 to 80 were followed over time. And those living with higher traffic-related shoot and the particle exposure showed that 20% more getting facial pigment spots, along with more pronounced wrinkles. And another separate German cohort study also linked the ozone exposure independently to coerce the wrinkle formation. So this is not just a theory. All this study is a measured, published, and peer-reviewed clinical evidence. And this gives us better understanding that what our patients breathe every day is visible on their skin. So the exposome doesn't only accelerate aging, it also drives the conditions that we treat every day in aesthetic and clinical practice. In acne, exposome factors such as pollution, diet, and stress modulate sebum production and inflammation. In atopic dermatitis, traffic-related emissions are linked to flare frequency. And in pigmentation disorders like melasma, UV, visible light, and pollutants act together on melanocytes. This means every patient sitting in our practice is quite literally carrying their environment on their skin. And mechanistically, these very different exposures converge on one shared pathway. Exposure triggers oxidative stress, and oxidative stress drives inflammation. And that inflammation activates matrix metalloproteinase. It's enzymes that break down the collagen and elastin. And this is exactly the pathway our regenerative and biostimulatory treatments are designed to counteract. And our job as the dermatologists is to help the dermal matrix to rebuild faster than the exposome can bring it down. And this is where our clinical mission connects directly with today's larger theme. Building skin integrity in the age of exposome means three things working together: protect, repair, and regenerate. We protect with photoprotection, antioxidants, and barrier support. And we repair existing oxidative and the structural damage. And we regenerate using the native collagen biostimulation to rebuild the thermal integrity that daily exposure keeps eroding. So skin resilience is not something that we simply preserve. It is something we actively help our patients build. So what does this mean practically in our daily clinical work? Three things. First, assess exposure history, ask about occupations, the commute, sun habits, the smoking, and stress. So we need to ask these things, not only their skin type. And second, set evidence-based expectations, because regenerative outcomes depends on a patient's cumulative exposomal load, not on the high-end device or even the topical product load. And the third, integrate prevention with regeneration. Biostimulation works best alongside with the daily protections. So it never as a replacement for it. In closing, let us remember this. Every single day, the exposome challenge our patient skin. And every single day, we as a dermatologist now have the knowledge, have the science to help that skin to recover, to renew, and to endure. So this is exactly the spirit of the today's webinar, from native collagen biostimulation to skin resilience. And thank you, and let's continue exploring the science together. Okay, thank you for staying with me through those two topics. Now I'm truly excited to introduce our next speaker. It's someone that work has shaped how we think about skin quality assessment to our patients. So please welcome Professor Dr. Reifa Faradwiana, SPDVE, a pediatric dermatology consultant and the head of dermatology, venereology, and aesthetic program at Faculty of Medicine, Pajajaran University. She will take us through two important topics back to back. First, redefining skin quality parameters beyond just the glow, and then the role of ionic technology in barrier recovery and skin resilience. And before we begin, for those of you joining us, feel free to type your questions anytime in the Zoom Q&A box or in the YouTube live chat. We will be collecting them for our discussion later. So to Professor Reifa, the time is yours.
Thank you, Dr. Ruri, for your very kind introduction. Good evening, ladies and gentlemen, professor and doctors. Let me present for the first presentation. Okay. Is it clear? Yeah. Okay. Thank you. First of all, thank you very much for the Aruna committee and also Podolsky, who invite me in this webinar event Aruna. It is very a great opportunity for me to present about redefining skin quality, key clinical parameters, and beyond the glow. We almost we frequent hear about the skin quality, but what is the exactly of a skin quality? It's like a terminology for the skin that have a very good quality that important to human attractiveness, not to only attract the people, but to the self-confidence, and also helps determine the need and choice of aesthetic treatment that really need for their skin. Skin quality significantly influences the perception of age, also attractiveness, health, and also youth. Age-related skin changes from aging-induced alternation that occurs in any of tissue layers. If we have aging in our surface, it's not only because of the superficial surface of our skin, but it's also the aging. It starts from our skeletal aging, and it will lead primarily to the loss of bony supports and also ligaments and the muscle, and leads to expansion of the facial spaces, increase the laxity and also volume loss. And after that, all the age-related changes in fat tissue and the face and lead to volume loss and also the sagging. So it's not only the superficial problem, but of course there's a problem in the base. Yeah. So until now, we don't have any consensus that would define what is the skin quality. In this journal that sourced in the 2021, the authors, Dr. Goldie et al., called the EPC, Emergent Perceptual Categories or Skin Quality, consists of four problems or for concern about the skin tone evenness, skin surface, and also skin firmness and skin glow. And these all four pillars that can make the skin quality make it good or not. The first one is the skin firmness. It consists of elasticity and also tightness and hydration. The form of the skin, we can see the elasticity. We can calculate it by cutometer, and also tightness with the pinch test or cutometer 2. And hydration is very important for we can make it ensure it with the hydration. And then the second one will be the skin surface. Skin surface evenness consists of pore size. Yeah, if we oily or acne prone skin, we can make we have a bigger pore size, and also creepiness or like wrinkles and lines, acne scar, and also about the hair and the clarity of the clarity, and we can make it measure it with the tools like a physia or something like that. And the third one is the skin tone. In skin tone, we have many problems in skin tone, like in Indonesian and also Asian, and we have a problem in pigmentation. And also erythema, if we can have a sensitive skin, and coloration of discoloration. And the evaluation, we can make it for a pixameter, we can count the melanin, and also the treatment options and the specific parameters that we can see in this table. But the skin tone evenness is one of our problem of the skin quality. And the last one, and we will address this one about the skin glow. The synonyms for glow are radiance, luminosity, brightness, and vibrancy, and complexion. And many patients here is obsessed for the glowing of the skin. We can enhance about the skin glow here, and can measure it with the pixameter, dosimeter, and something like that. And then many treatment of for the make glowing skin. One of them is that I will address after this presentation, and also my other colleagues will present about this after this. Okay, and this is one the affected base of the tissue origin that I said before, the epidermis and also the dermis is all have a problem for the skin aging, and this is a treatment option for the skin firmness, skin glow, skin tone evenness, and also skin surface. We can make like a botulinum toxin, or also CAHA, also in other topicals, lasers, and etc. Okay, and this one is algorithm. It's very complicated, but we can see all of these treatments for the make skin quality is that we can have a skin quality that we want to have it. And also the management of harmless in multiple tissue layer with many of the laser or other evidence-based devices. Thank you. The first one is in my presentation about the skin quality, and the second one I will present about the okay, right, okay, continue to share. Yeah, okay. About the hydration. The hydration, as we know, this is the very important thing. This one is the one pillar of the skin quality that I've told before. But beyond the hydration, there's another role of the ionic technology in barrier recovery and skin resilience. As we all know, there's so many skincare here that have many ingredients, but almost we sometimes we forget about the one thing. It's ionic or minerals that have a very important role in the skin barrier, of course, and especially skin recovery and skin resilience. This presentation represent the ingredients of extra care by Pepe Interbat. Okay, for the introduction, the skin barrier, we all know about the skin barrier here, about the brick, corneocyte, and then mortal, the lipid bilayers here. And then if the skin barrier disruptures, as many things can happen, there's about a lot of allergens and also irritants can come easily to disrupted skin and make many problems such as dryness, allergy, itching, stimulation, and also acne and of course aging. Okay, the active components of the skin primer barrier family, including we can see here is stratum corneum consists of 5 layers. Epidermis consists of 5 layers for the stratum corneum, and also the basal epidermis and also the dermis. This is the live surface, the live tissue that can connect each other with many of immunologic cells that can communicate each other and make like inflammation or recovery. But we almost forget about the skin mineral. What is the skin mineral? Skin mineral is a key role of inorganic elements in skin physiological function. We know that our body composes of 60 to 70% of water, and it provides the medium of the interaction of organic and inorganic molecules. The interaction with water is very crucial for several life sustaining, like absorption of the nutrients, tissue growth, and etc. But ionized form is in this mineral get access to cells and tissue to become integrated into the living matter. Now we have bulk organic elements like oxygen, hydrogen, carbon, and nitrogen. But also we have mineral micro elements like calcium, magnesium, and we can call it in oligo elements. Yeah, but it's have a very important function for our skin. Like here, we can see here that we have a macro elements, oligo, and etc. But its skin barriers relies on optimal mineral balance. Yeah, all of these chemical composition as in the mineral balancing. In this picture, this is the stratum corneum, granulosum, spinosum, and basalis. And we can see the natrium, also the calcium, phosphate, calcium here. There's many consists, it's not so many in the basal, but it's many in the granule, this spinosum, and also the granulosum. And it's the composition of the ingredients of composition in each layers is different between many minerals. But we have to remember the function of mineral elements is for self-formating function and then cell metabolism and bioenergetics, epidermal differentiation, dermal remodeling, and also skin regenerative. And this is very important to prevent the aging. And also the calcium and magnesium physiology has important roles, not only for the muscle, bones, and also it's for the skin. Yeah, the mineral of the skin, we can see here the zinc, selenium, copper, magnesium, iron, and calcium. But yeah, in this presentation, we can address, it can make pressure in the calcium and also the magnesium. This is the function of epidermal layer for the protection against their barrier dysfunction, water fluid balance, and differential and proliferation. And we don't have to, we have to remember the calcium ion here. This is the main signal factor for keratinocyte differentiation. And also we call it the second messenger for communicate for intercellular. Yeah, this is the proliferation and the differentiation of keratinocyte. It depends of extracellular calcium concentration. So our skin have to have a proper concentration of the calcium. Yeah, this is the calcium here for the epidermal differentiation, lipid barrier, also for cell adhesion and barrier repair. And calcium is not typically as a standard topical treatment only, but it can make it we can make it a calcium in the cream, lotion, and serum for daily apply in our skin. And this is the other roles of the calcium to repair the barrier disruption and also inflammation and skin immunity. And then also we have magnesium for skin hydration, anti-inflammatory, skin repair, antioxidant activity, and also barrier function. And the magnesium, it's not only in topical, but we can have it in the minerals, yeah, systemic, and also in the meals, and also in the fruit or and etc. Okay, the most important thing we have to remember that calcium and magnesium have to be in the balance. Yeah, the cellular process are essential for skin and function if both mineral in the balancing, because it can maintain the skin barrier function, also the wound healing, the oxidant properties, and etc. Okay, this is the research of the calcium and also the magnesium. And also this is the schematic keratinocyte differentiation. And the calcium has a important thing because calcium ion have to be balanced. Yeah, in the epidermis, calcium is abundant in the surface, the stratum corneum also, and it will decrease until the basal layer. Yeah, here like this, but in magnesium and in calcium here, but in the magnesium, the role of the magnesium in cell proliferation is almost the same. But magnesium here for the proliferation of the skin, of the cells, and also the apoptosis. But magnesium stimulates the DNA and protein synthesis and cell growth, metabolism increase. But contrary, magnesium deprivation induce growth arrest and stimulate differentiation and apoptosis. That's why it has to be balancing between the calcium and magnesium in the skin. Okay, you can see here the healthy cells, magnesium extracellular, calcium intracellular, but here unhealthy cells, the calcium is came out from the intracellular and mixed with the magnesium. So magnesium deficiency allows too much calcium into the cell. But here we can see in the thermal spring water, there's in the France, there are many minerals here, and also the spring water from the Korea contains a lot of calcium and magnesium here. The different spring water in the different country, and also the weather and climate. And the magnesium calcium here parameters, the spring water temperature should be the magnesium is the calcium is 3 times more than magnesium. Here we can see, but it helps to the collagen type mRNA collagen type, and it will like stimulate the production of the collagen if the balancing of the magnesium and calcium is in the same way. This is another journal from Korean University Medicine that found the effect of calcium gluconate with natural extract on the skin toxicity and hydrofluoric acid. And they're using calcium and magnesium ion treatment. And so from this journal, and also the calcium and gluconate mineral cation and gluconate organic anion. It's the equilibrium of both of the minerals and make in the skincare and give a good result for other tissue damage. Yeah. This one, the picture is tissue damage by HF or hydrofluoric acid. Okay, and proven by the immunohistochemical analysis here with the hematoxylin eosin staining, the staining of epidermal and dermal layers, and also the mesenterichrome staining. We can see the immunohistochemical analysis of the mice at the 7th day after exposure had amount of collagen production. And it confirmed the skin tissue was the same as normal skin. On the other hand, non-treatment and control less collagen amount, and even skin texture and severe skin irritation and damage. So we can see it's a very good result after using the Glucay like that, the Glucay topical like that. And also for the recovery of the wound before treatment after 2 weeks and after 1 week. So these topical ingredients containing the calcium and magnesium can also make a good result in the wound healing process like this. So for the conclusion, there are 2 ways to strengthen the skin barrier. First, the external way to strengthen the skin barrier function by applying multilamellar emulsion. And also the internal way is to promote the differentiation and proliferation of keratinocyte to restore the stratum corneum. But we don't forget about the calcium and magnesium, the 2 most powerful minerals, with the ion balancing minerals combined with MLA to restore barrier recovery at the epidermis. It's for the good for achieving treatment for various skin disease like atopic dermatitis, psoriasis, acne, and also for anti-aging and pigmentation. And of course, for the wound healing, post-dermatological procedures like the laser, injectable surgery, etc. And also for the ulcer, like I shown at the previous slide. Okay, thank you very much for your attention. And now, okay, I can stop share. Okay, thank you, Dr. Ruri, for your kind opportunity to me to give this presentation. Thank you.
Thank you so much. Thank you so much, Prof. Reva, for that comprehensive overview. So I think many of us will look at the skin quality parameters differently after tonight. So next, we move into something very practical. How do we actually select the right patients, the right product, and the right treatment when it comes to biostimulation? To answer that, please welcome Dr. Stanley Setiawan, SPDVE, FINS-DV, FAA-DV, a well-known dermatologist who needs no introduction, currently practicing at C-Derma Dermatology and Aesthetic Center, Jakarta. Dr. Stanley will also continue with a second talk exploring a very exciting emerging topic, native type 1 collagen, from the science behind it to what it means for our clinical outcomes. And just a quick reminder for our audience, do keep sending in your question through the Zoom Q&A box or the YouTube live chat. We will bring them into our discussion shortly. To Dr. Stanley, please go ahead.
Thank you, Dr. Ruri. Is my voice clear?
Very clear, Dr. Stanley.
Okay, thank you. Thank you so much. Distinguished professors, respected all my teachers and seniors, beloved colleagues, and everyone. Assalamualaikum warahmatullahi wabarakatuh. And Very good evening to everybody. Thank you. It's a privilege for me to be here joining the webinar from Aruna. And thank you also for Prodosky and Aruna Committee for this opportunity. So I would like to share my presentations for today. Okay. All right. So I will start my presentation with these illustrations of video. For many years, we've been performing countless of non-surgical and surgical aesthetic medicine procedure. We are becoming so good in restoring and balancing in terms of a cosmetic medicine. We lift the skin, we try to smoothen the lines, contour the faces, and right now, I would say we have more and more injectable products available than we have ever before. But despite all these advances, one question remaining, are we truly treating the aging sign? Are we truly treating the cause of aging? Or we just been treating as a correction the aging signs on our patient's face? So tonight I will share with you biostimulation in regenerative aesthetic medicine, a practical approach to patient, product, and treatment selection. And objective of this presentation, we are going to talk about the biology of aging, current collagen biostimulator, and then introductions of native type 1 collagen, its mechanism of action, and providing also for all of us clinical cases and scientific evidence. So right now, we have a paradigm shifting in aesthetic medicine. Over the past decade, aesthetic medicine has undergone a major paradigms shift from the old paradigm to the new paradigm. What is the old paradigm? We acknowledge that at old paradigm, we focus only on the volume replacement. We're using many portfolios, such as fillers, to lift and fill. But what we did, it's only temporary effect, and there is no aggressive improvement in skin quality, and it doesn't address the root cause of aging. The question we always ask on the era of old paradigm is, what products should I inject? But now we're shifting our focus to the new paradigm, which is restoring what is natural. Focus on tissue biology using biostimulators to activate the body's own regenerative potential. The result that we gain from this new paradigm is a natural and long-lasting improvement, improved skin quality, elasticity, and texture, and also addresses not only what we've seen on the superficial skin, but also addresses the root cause of aging. So the question now that we should ask is not only about the what product that we need to use or should we inject, but what biological process should I or we activate. This is the essence of regenerative aesthetic medicine, with not just changing appearance, but restoring biology, not just feeling, but regenerating. So, why biostimulation is become a highlight in these presentations? With the following explanations, we have two pathways and two future, and the choice between aging and regenerations. Before we dive into the biostimulations, I would like to take you back the understanding of aging cascade. Wrinkles that form in the skin or our patient's face is not solely the aging process, but the aging cascade happen on the extracellular matrix with the signs of fragmented collagen, reduce of elastin, impair of fibroblasts, increasing of inflammation, and as well oxidative stress. The degradation and extracellular matrix will trigger fibroblast dysfunction and leads to collagen loss. What we see in the superficial appearances is skin aging with the thin, lax, dull skin and also wrinkles. Aging is not something that superficially happen, but it's a biologic process. We need biostimulations to address the biologic process itself. Biostimulations that we are using works by control biological signaling to activate the fibroblasts and then leads to remodel of extracellular matrix. And as a end result, we can gain healthier skin with firmer, smoother, radiant skin, and also improvement of the quality of the skin itself. So, biostimulation is not merely filling, but it is inducing biological regenerations. When we use the biostimulation with correct dosage and we see the patient needs, what we can gain is a healthy extracellular matrix with the organized collagen, elastic fibers, and active fibroblasts, reducing inflammation and also oxidative stress. So again, biostimulation is not merely filling. It is inducing biological regeneration, which is the baseline process of aging itself. There are two categories included in a biostimulator. The first one is a mineral base, and the second one is a polymer base. Let me walk you through with the mineral base first. For example, is a calcium hydroxylapatite. Calcium hydroxyapatite is a smooth microsphere, provide immediate support and act as a biostimulatory scaffold when we inject to the intradermal or subcutaneous of the skin. After the injections, there will be immediate effect and provide instant volume support. Following to that, there will be a calcium ion release, and gradual release of calcium ions creates a localized microenvironment that attracts immune cells. There will be activation of macrophage following from the calcium ion release and also fibroblast activations. At the end of the cascade, there will be an extracellular matrix remodeling. The formations of new collagen and elastin are deposited, which can improve the skin quality, elasticity, and firmness. The second category from biostimulator is a polymer base. And for example, like poly-L-lactic acid, poly-D-L-lactic acid, and PCL. Different from calcium base, polymer is a biodegradable microparticles or solution that aim for stimulate the collagen through a control inflammatory responses. The mechanism of action from the polymer, once we inject, polymer microparticles will deposit in the dermis and subcutaneous tissue and causing early inflammatory response. And then following to that, there will be activations of macrophage and causing recruitment and activation of fibroblasts leads to collagen remodeling. The result from the polymer base is gradual and natural improvement in skin thickness, firmness, and overall skin quality over time. Both of the biostimulation, mineral or polymer base, aiming for increased collagen production improve the skin texture, enhance firmness, and long-term rejuvenations. Moving on to the next slide. So, like previously mentioned, mineral-based or polymer-based has their own mechanism of action. And now we are talking about who is the best candidate for each of biostimulators. We start with the mineral-based or calcium hydroxylapatite. The best candidate profile for mineral-based would be patient with age category between 35 to 60 years age, mild to moderate facial aging, and we find early loss of jawline definition, then mild skin laxity. Meanwhile, for the polymer-based candidate profile, age 45 years and older, generalized collagen depletion, facial deflation, advanced aging, and patient understand that using polymer-based will result in develop gradually to 6 months. So these are algorithm that we can use when we are using calcium or polymer base. If the patient need immediate correction and regeneration, we can use mineral-based calcium hydroxylapatite. But when patient accept gradual result between 2 to 6 months, then polymer-based is an answer. When we find localized contour deficiency, we can use mineral-based. But if diffuse collagen depletions find in the face or body, then we can use polymer-based biostimulators. So, in conclusion, the current scientific evidence will support both mineral and polymer-based collagen biostimulators when they are used in appropriately selected patient and with proper injection techniques. The question is no longer which product is the best, but rather which biological mechanism is the most appropriate for this patient. So the one final message, we need to focus on patient first, and then biological mechanism at the second, then the third or the last, we can choose the product. I should give the virtual screen to Dr. Ruri before we continue with the second presentation. Or shall I continue, Dr. Ruri?
Yes, Dr. Tanner, you can proceed to your second presentation.
So my second presentation is all about beyond biostimulation, the emerging role of native type 1 collagen in regenerative aesthetic medicine from science to clinical outcomes. And this is my disclosure. This presentation is sponsored by PT Interbat Aesthetic. For so many years, we understand that the stimulations of the collagen always associated with the previous biostimulator agent. The mechanism of work is always by controlled inflammation to get the wound healing. The questions, can we regenerate tissue using the body's own extracellular matrix signal instead? This is where we can use the native collagen as one of the workstation for regenerative medicine. So I tried to sum up everything in one slide, starting from the question, why do we need a new regenerative approach? Previous portfolio that available mainly act as a scaffold, rely on controlled inflammation and regeneration through wound healing cascade. But right now, the need is, can we regenerate the tissue using the body's own extracellular matrix signal instead? So what is native type 1 collagen? By definition, native type 1 collagen is naturally preserved triple helical collagen extracted from equine-derived tendon while maintaining its native molecular architecture and biological activity. The mechanism how the native collagen work biologically, starting from the injections, native collagen will creating a scaffold in the soft tissue, and since the native collagen from equine tendon derived resemble natural human collagen, it will bind to the receptor of the fibroblast called integrin. And following to that, there will be a fibroblast activations and leads to remodeling the extracellular matrix. When the interaction between the native collagen with integrin receptor of fibroblasts, there are several occasions happen, starting from the adhesion, proliferations, and signaling that leads to remodeling or stimulations of the collagen 1, 3, and increasing of the elastin. Every age category will benefit from the native 1 collagen, and there are multiple ways how we inject it. The clinical outcomes that we can observe, starting from improved skin textures and tone, reduced fine lines and wrinkles, and the evidence shows that before we will find sparse fibroblasts, fragmented collagen, disorganized extracellular matrix, and thin dermis, and after native collagen, we can see the improvement, the opposite before we injecting the native collagen. So the manifestations as a clinical evidence, we can find improvement in skin elasticity, reduction in wrinkles, improved skin hydration, and also high patient satisfaction. Perhaps this following video will explain in details how the mechanism of actions from native type 1 equine derived collagen. Let's have a look. And for that video, I would like to say thank you to my colleagues, Dr. Dude from Bali, who created very nicely and well explained. So the ideas of native collagen can be used as sole treatment or in combination therapy with HA-based filler or with biostimulators that previously explained, botulinum toxin, lasers, and microneedling. Native collagen will create repairment or taking the extracellular matrix back to the physiologic state. Furthermore, I would like to share with you a case from my patients. She's a female patient, age 50 years old, came to the clinic with expectation. She didn't want to be injected with volume replacement like fillers or toxin. She just wanted to have a better skin quality and look fresh for her age. So I decided to inject the native collagen and explain to her that it will require sequences to see the best outcome or result. So this video explained the journey from the patients when we look at her face, there are multiple considerations and aging visible on her face. We divide it into two major assessments, starting from structure assessment for the whole area of the face, and then continue with the textural assessment thoroughly. And I use native type 1 equine derived collagen, mixing it with saline and lidocaine. And after anesthesia injections, the native collagen distributed equally using cannula with all over the area. And this is before and after first injections. And interval time between one injection to another injection is 2 weeks. And she completed 3 times injections, one by one. And this is shows before and after first injection, second injections, and third injection. So the picture here shows you the improvement time to time. As we go back to the theory over aging, aging is a biologic process that require time for repair. Using native type 1 equine derived collagen injected on the subcutaneous, we can start to see the result after the first injections. I need you to focus not only for the wrinkles, lines, and grooves, but for the total skin quality and volume depletions that we observe before injections. After first injections, collagen that implemented on her face, starting to remodel from time to time. After second and after third injection, we can see obviously the improvement in terms of skin structure or textures. But this is subjectively measurement using DSLR camera. To validate more details, we are using, or I was using a quantifier to show you the significant improvement from baseline picture to after 3 injections. We can see the face contour, skin firm, and overall skin quality is improved. When we talk about the native type 1 collagen derived, we need to remember that it's always related with tensile strength. Secondly, transduction or mechanic support. Third, skin firmness. And the last one is dermal repair or architectural physiologic repair. So what we are expecting from this type of treatment is not something that aggressively changes the shape of the face, but to see structurally and texturally improve from time to time. Patients still has their own expression, but enhanced. And this appearance or results show you how the lifting effect happen after third of the injections, represented by a red arrow, orange arrow, and yellow arrow, representing aggressive lifting, medium, and also mild lifting on the differences area of the face. And to see the 180 degrees rotational view, we can obviously look at the improvement that can be seen on the superficial and structural of her face. Okay, the second patient is a courtesy of Dr. Christiani from Semarang, my beloved colleague. Native type 1 collagen is also one of the best options for senior patients that has everything related with aging signs on their faces. In these patients, we can see obviously the improvement in terms of volumizing. There is nothing that we feel that we injected and feel the volume loss, but the repairment on dermal matrix increase or contributing to the density of the dermal, and it happened that it looks like the skin lifted and volumizing after time. And by closer look, we can also see the improvement, not only the structure, but also the textures. The pigmentation improve and pore size, also the fine wrinkles also improve. Okay, this one also showing you the lifting effect and tightening effect all over of the patient face. And when we use injectables, in particular native type 1 collagen, and in my own experience, it's totally something that safe and effective, but ongoing process. Sometimes we can cope with mild edema, bruising, pain, and hypersensitivity. And there are also contraindications for native type 1, which is pregnancy, active infection, collagen allergy, and autoimmune disease. For key take-home message for today, I will say that native collagen is not simply another collagen stimulator. Nonetheless, it functions as biological matrix, capable of restoring extracellular matrix homeostasis through preserved molecular architecture and cell signaling. Instead of inducing regeneration through inflammation, native type 1 equine derived supports regeneration by providing biological information to resident cell, or it makes biological cue reactivate. So this is something that I thought can we use to simplify the generation that evolved in our industry or in aesthetic medicine. Starting with generation 1, we use filler and replacement, and it evolved into biostimulator. Once we understand that aging sign is a biological process, and now we can use also native collagen with different goals, which is to restore the extracellular matrix. So in conclusion, native type 1 collagen introduced a different regenerative strategy with a preserved triple helix, which generates biological signaling, and following to that, activate the fibroblasts, and also the biological cue shown by remodeling of the extracellular matrix. And native type 1 collagen is one of the best options with excellent safety profile and valuable adjunct in regenerative aesthetic medicine. Right now, beyond stimulating collagen, we are restoring the language of extracellular matrix. So I will close my presentations with the closing statement. The future of regenerative aesthetic is not merely stimulations anymore, but we are going to focus on the restoration. Thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh, and have a good evening, everyone. I shall give back virtual screen to Dr. Ruri. Thank you so much.
Thank you, Dr. Stanley. What an incredible run of talks. So we already have ethics, we already have exposome, skin quality parameters, we have ionic technology, and now native collagen biostimulation. I think we have a lot to discuss tonight. So let's open the floor for question. Since we only have 5 minutes, I pick 2 questions here. And the first question is to Professor Reva. There's a question asked, if I want to combine the product range with other active ingredients such as retinoids and azelaic acid, what is the best way to combine them, especially in cases of severe acne?
Yeah, thank you, Dr. Ruby, and also Dr. Richie that give me this question. Yeah, it's interesting because we can mix this product range with our maybe a more powerful topical ingredients such as the active ingredients such as retinoic acid and also azelaic acid. Because the retinoic acids is only applied at the night, so for the night cream, we can continue the retinoic acid and also azelaic acid based on the disease, yeah, such as the retinoids for the acne and azelaic for the sensitive or acne sensitive skin. And other product range, we can use it in the morning and the afternoon because it's have a lot of range from the also the facial wash and also the serum, moisturizer, and sunscreen, etc. But the active ingredients, we can still continue to use it at the night. Thank you, Dr. Luri.
Okay, so we can combine all of the product with the basic active, but
Yes,
customized with the skin type of the patients, right?
right.
Okay. Thank you, Professor Reva. And I think we have another question. I believe it's from the same doctor to Dr. Stanley. Good evening, doctor. I would like to ask, can native collagen be used to treat hypertrophic scars? Thank you.
For the question. Yeah. Okay. Native collagen is not a first line for hypertrophic scar. However, there are robust offline treatment using native collagen for hypertrophic scar with the strategy to repair the fragmented of the collagen on the hypertrophic scar. Indirectly, we are trying to reduce the overactivity of fibroblasts since there are resemble native collagen that will integrate or binding to the fibroblast receptor. By doing so slowly, and it will require times, the hypertrophic scar will be softened, and it represents that the repairment starting to be seen on the hypertrophic scar. So what I'm trying to say is not first line, but we can use it off label after we try several strategies for hypertrophic scar from first line, second line, and the third line, Dr. Ruri.
Okay. Thank you, Dr. Stanley. So I think the time's up for this session. And I would like to say thank you to Professor Reva and Dr. Stanley. And now we're moving into a session, the next session, that I personally find one of the most valuable formats because it's the real case discussion. So this session is the regenerative decision room, and where in this session we will look at two real clinical cases and think through the decision making together live. So let's welcome Dr. Jonathan Subekti, SPDVE. Dr. Jonathan is a dermatologist and graduate of Universitas Indonesia, currently practicing at Skin Cure Clinic Jakarta. Dr. Jonathan will present his case on this first case. To Dr. Jonathan, time is yours.
Thank you, Dr. Ruri, for the kind introduction. Can anyone hear my voice clearly?
It's clear.
Oh, yeah. Good evening. Yes, we need to share my case of biostimulation and volume restoration patient. Has my screen shared?
Not yet. Yeah, now it's here.
Is my presentation sheet?
Can the committee help to share Dr. Jonathan's screen? We still, yes. Yes, now we see it, Dr. Jonathan.
Rory.
Sorry, Dr. Jonathan, we can hear your voice. Still muted, Dr. Jonathan.
On that day, therefore, after the assessment, we could see that the patient has mild skin laxity, mild flattening of the malar region, prominent nasolabial folds, and also marionette lines, blunting of mandibular border and also mandibular angle, and also a little bit of jowling. So in this patient, we can conclude that she has both volume loss and also an optimal skin quality. Therefore, my first plan was improving her skin quality and give her calcium hydroxyl lipotide KH biostimulation on the face and also neck area.
Pardon, Dr. Jonathan. Sorry to interrupt. Can you speak louder?
This is the result of the KH biostimulation after 4 months. Why I choose 4 months? Because I wanted to see the results of the stimulation, not only the CMC gels on the skin of the patient. So after 4 months, we can definitely see some improvement in the skin quality.
Dr. Jonathan, sorry, you still muted. We can hear your voice. We cannot hear your voice. Dr. Jonathan, sorry, we cannot hear your voice. Dr. Jonathan? Pardon, but we cannot hear your voice because you're still muted. Is it possible that you can repeat your presentation again? Yes, Can you hear my voice? Dr. Jonathan, we cannot hear your voice.
Oh.
Sorry, we cannot hear your voice and we cannot hear your presentation.
Oh, okay.
Yes,
Should I start from the beginning?
yes, please. Yes, please. Thank you.
Okay, my apology for the issues. So, okay, Dr. Rudy, can you see my slide now?
Not yet.
Not yet? Sorry, I've been sharing. How about now?
Yes, now we can see that.
Okay. Okay, thank you, Dr. Ori. Sorry, everyone, for the technical problem. So, good evening, everyone. Please allow me to share my case of biostimulation and volume restoration patient. So, this is the patient. She is a female, 64 years old, and she has no specific request for her treatment. Therefore, after the assessment, we could see that the patient has mild skin laxity, mild flattening of the malar region, prominent nasolabial fold, and also marionette lines, and also blunting of mandibular border and also mandibular angle, and also a little bit of jowling in this patient. So we can conclude that this patient has both volume loss and also an optimal skin quality. Therefore, my first plan was improving her skin quality by giving her calcium hydroxyl apatite or KH biostimulation on the face and also neck areas. This is 4 months after the treatment. We can definitely see some improvement in the skin quality without significant volumizing. Why I evaluate this patient after 4 months? Because I wanted to the CMC gel to be absorbed first. So what we see in the patient is the stimulated collagen and better skin quality. And we can see also patient's marionette line and also nasolabial fold also mildly improve. With higher magnification, we can see big improvement, especially in the fine wrinkle. And in this both photos, you can see different skin tones. However, this is not due to pigment changes, but more because her skin quality is now better, so she can reflect the light also better. However, in this patient, we can still see some volume loss, especially in the temple, cheek, chin, lip corners, and also nasolabial folds. So in this patient, I give hyaluronic acid injection, 2 cc, using crosslink 26 milligram hyaluronic acid. This is 1 month after the HA treatment. We can see that the patient looks even much younger, and the nasolabial fold much improved, and also the pre-jowl sulcus also improved. This is the final before after. This is her before the treatment, and on the side after 4 months after combination of KH and also HA treatment. Why in this case I'm combining these 2 products? Yes, of course we can keep doing biostimulation in this patient with the KH. However, we have to remember, just like Prof. Reva said in the presentation earlier, we have to remember that the aging process affects every anatomical layer, from the bone up to the epidermis. So by addressing all the layers there, we will be able to give a more natural result. Thank you. Get back to Dr. Uri. Thank you.
Thank you, Dr. Jonathan. Thank you, Dr. Jonathan. That was such a clear framework. So now, following Dr. Jonathan, we will have Dr. FX Clinton, SPDVE. Dr. Clinton is a dermatologist and graduate of Universitas Hasanuddin, who is also very active on social media sharing dermatology education and currently practice at Jiva Dermatology and Aesthetic Clinic. So to Dr. Clinton, you can start your presentation.
Okay, let me share my PowerPoint. Sorry, Dr. Reed, is my voice clear?
Can you speak louder, Dr. Clinton?
Sorry, is my voice already clear? Yeah,
it's clear now.
Okay, thank you. So let me start. Before I start, I would say thank you, Professor, Dr. friends, colleague, for having me here. And first of all, I would like to introduce myself. My name is Clinton. I'm a dermatologist. I would like to share about a serial cases about the infraorbital dark circle and should we avoid or treat it. As we all know, treating infraorbital dark circle is very hard and very challenging, but the demand is very high. Okay, and then I've tried so many things like salmon DNA, PRP, even for a collagen stimulator, but it's not works very well. In the okay, let me share my case. Let me start sharing my case. I will tell you about what I'm using in the last after the cases. So this is the first case. A young woman have a hollow dark circle in the infraorbital, and the skin, the texture is not really nice. It's yeah, she has a dark circle, and that's 1,000 people problems. Okay, this is the results after 2 sessions, and the session each sessions 3 months apart. Okay, I'm using this volume, and this is the hard and soft 1 cc and 0.5 cc, and it's not a filler of HA. It's not HA filler, but I'll tell you what I'm using. Okay, and I've seen the patients is very satisfied, and I'm satisfied too about the results. Okay, the texture it's improving, and the dark circle too it's improving too, and she get married. Okay, and the case number two. This is
Sorry, Dr. Clinton, can you make a slideshow?
oh sorry. That's my okay, sorry. Okay, is that already clear? Okay, sorry, Dr. Ruri. There's my PowerPoint already in the share. Okay, case number two. This is the post-fat removal. She felt a hollow after the fat removal, and have a dominant groove after fat removal, the lower blepharoplasty. She is not very happy with the results. She came to me and asking, "Is there any thing you can do, doc?" Okay, I done the thing using the biostimulator, injecting, and after 1 session, yeah, in the grooves and the skin is smoothened. Okay, this is the before and after. Okay, the case number 3. This is the This is what I like a lot. These patients, the results, the before she has hollow and the dark circle. This is 2 sessions of the biostimulator that I used to, each 3 months apart. Okay, and have a nice results too for the under eye hollow and the under eye, the contour and the color. Okay, this is case number 4. The case number 4, yeah, 2 sessions too, and this is the results. Okay, the contour, the dark circle, and the hollowness is improving. Okay, so the advantage for this biostimulator, not really for the volume, but the texture is very good and the color, yeah, it's good too. So can you guess what I'm using? Actually, it's not a collagen stimulator and it's not a HA2. Yes, I'm using this one. I'm using the patient's own blood, and I denaturate it to make it a gel. Okay, so basically it's a filler, but for me it's a biostimulator because for the volumizing it's not really good, but the effect of the collagen stimulator is it's really nice. The skin is getting thick and the texture is really nice too. Okay, we call it a plasma gel. Plasma gel, also known as a PRGF, plasma rich in growth factor. It's a denaturate PPP. Okay, and it can forming gel-like substance. Okay, so last but not least, under the eye dark circle, it's for me it's a tissue regeneration and cosmetic filling purpose, and PRGF gel is the answer, and for me, yes. Thank you.
Okay. Thank you, Dr. Clinton. Love the cases and love how practical it was. So now we will continue with, let's bring us everyone together here. And so I'd like to invite all the speakers and panelists to join the discussion so we can look at those cases from a few different clinical perspectives. We will start the panel discussion. We have a longer time here. We have 20 minutes. So now let's start with Dr. Jonathan cases. Dr. Jonathan, so what made you choose this particular approach over more other conventional option for these patients?
Okay, thank you, Dr. Rory, for the questions. Yeah, actually, we can choose from a lot of biostimulators available out there. And also, like you said, conventional method, maybe doing skin booster or hyaluronic acid. But in this patient, I prefer to improve the skin quality first by doing the KAHA. And as we know, doing any biostimulation takes several months for the patient to see the results. That's why I prefer to do the biostimulation first to improve the skin quality. And then after that, I do the fillers. By doing that method, I find the fillers that required to restore the volume is much less than starting with just straight away using the hyaluronic acid filler. So by this approach, I find it more practical and also more efficient for the patients. Thank you.
Thank you, Dr. Jonathan. And talking about the skin quality, I would like to hear some thoughts from Professor Reva. So Professor Reva, if you saw this Jonathan case, would you prefer to combine Dr. Jonathan approach with other modality that you think it will compatible to these patients to enhance her skin quality? What do you have in mind?
Yeah, yes, that's Ruri. Because in that case, we can see the aging process is starting in this patient. So we have to make improvement of the skin quality, especially at the surface of the skin. And we know the calcium and also magnesium properties in this skincare, skin product can make improvement of the skin barrier and also the proliferation of the epidermis and also the improvement of the wound healing after the treatments. So this is the good combination. If we can make after the treatment, we can use this product and also the continue for the daily products too.
Right. Thank you, Prof. Reva.
Okay.
And Dr. Clinton, it's very interesting that you choose the plasma gel to these patients. What is your mind? Where you had to change? Is it your original treatment plan for these patients, or you initially tried to other modality and then you change your plan? Why then you choose to give the patient this regenerative with plasma gel? What's your consideration?
Okay, thank you, Dr. Ruri. It's really good questions. Actually, this patient, it's a virgin, never tried collagen stimulator, HA, and other biostimulator. So I choose the virgin eye, never touched by anything biostimulator. So it's the what I'm choosing this kind of treatment because I'm curious about the results that I've done uh, several times using other biostimulator. It's not really give a nice results for under eye treatment. So I'm searching in the study in the studies. There's one study said that using the PRF gel is really nice for the infraorbital dark circles. So I'm curious about it, and I tried it, and I see a good result too. That's my consideration, just my curiosity. Yeah, and I want to share to all of you because I think yeah, it's really promising. I think. Thank you.
So you choose it because you saw the evidence
Yes.
from the literature.
Yes, but actually, dermatologists out there, I saw it in India. They use the PRF gel for amorphia, for case of morphia in atrophic skin. They use it, and they use it for the hand in the morbus Hansen's persons. Yeah, they use it the PRF gel too, and it's really a good results too. But needs repetitions for the treatment. I'm using 3 months apart, but in the case studies, they use 2 weeks apart for 3 times and then repeat it again 3 months.
I see.
Yeah.
You said morphia?
Yes.
From India, it's used for morphia.
Yeah.
Oh, that's very interesting. Okay, so before we jump into question from the audience, I would like to ask to all speakers and all the panelists here. So actually, it's practical. It's practical question. So the question is, if budget or downtime were limited, if budget from the patients were limited, how would you prioritize which regenerative approach to use first? Maybe we can start from Dr. Stanley.
That's a very hard question for tonight. For myself, it always depends on the patient needs. As a first strategy, we will assess everything and then goes back to their needs. And following to that, available treatment in the clinic and explain to them every options. When it comes to the budget concern, then I would say I will again try to go very simple with the treatment. For example, I will start with native collagen or HA non-cross-link boosters. Why I'm doing or I'm choosing both of the portfolio based on the principle to restore the extracellular matrix. And from there, when the cell is or the dermal architecture is back to the physiologic state, I think it will become the very, very good platform to continue with another treatment in the future. And I would say there are plenty of HA non-cross-link booster that available in the market right now that's affordable for everybody. And also with native collagen, there are, of course, a variety in terms of prices out there, but we can always choose that. For example, in my clinic, I always provide more than one brands, Dr. Ruri. So the patient can choose wisely and accordingly to their budget. Having said that, regeneration treatment, aesthetic medicine, or aesthetic procedures is always really good when we put it in a program. So, explaining to the patients one program to another will require time to see the result. We evaluate, and by doing so, we can also arrange for the budget from time to time. That's maybe my answer, Dr. Ruri.
Thank you, Dr. Stanley. It's good to know your perspective on this. Professor Reva, you want to add comment for the question?
Yes, basically the skincare is the foundation of or the basic for any process of the skin and also after the procedures of the skin. So but it's only maybe it's only superficial. Yeah, as we know, the penetration of the skin care is only to the dermis or upper dermis. But if you want to make a more enhancing the quality of the skin, yeah, we can inject like this collagen or something like that. But overall, the surface is we have to protect and maintain the quality of the surface with the skin care, as I mentioned before.
Right. So topical still have roles, and
Totally.
yes, agree with you, Professor Eva. And how about you, Dr. Jonathan? What would you choose first if the budget is limited for the patients?
Yeah, Prof, if the budget is limited, yeah, we can find another form of stimulation. We can use maybe energy-based device. Yeah, because mostly good injectables has a good comes with a good price tag. So yeah, we have another options, even though it may not as effective as the injectables. Maybe we can use like chemical pills or lasers. Thank you.
Thank you. So energy-based device can use for that, but without consumables, right? Because if you choose energy-based device with consumables, then the price will be higher. Okay, Dr. Clinton, you have something in mind for this?
Yes, actually, there's no cheap in aesthetic Then
Sorry, can you speak
world,
louder?
okay. Actually, there's no chip in aesthetic world, but I will choose the autologous one. Yeah, PRP or PRF gel. It's very cheap and it's effective. Yeah, that's
So
all.
the autologous
And
regenerative from the
regenerative.
patient itself.
Yep.
Very interesting. Thank you for all the answer. So let's jump to a question from the audience. We have this very interesting question from Dr. Sri Hotnauli. Actually, it's for Dr. Stanley. So she asking that since native collagen promotes regeneration without relying on inflammatory response, does this translate into a lower risk of adverse events such as fibrosis, nodules, or unpredictable tissue remodeling over the long time? What do you think, Dr. Stanley?
So much. And thank you, Dr. Sri, right? Okay. Thank you for the understanding of basic concept of native collagen. It works through non-inflammatory process. Um, Native collagen is still new for us, even though it's available already in the Western world for more than 2 decades. And what I'm trying to answer you is based on data and on journals. For as long as that I'm concerned, and based on the data, there's no inflammatory nodule or complications in terms of a formulation of granuloma from every journals of native collagen that I can find right now. So the treatment considered safe and effective. Regarding the connection between a non-inflammatory process and the risk to create or triggering the side effect, it has a connection because we don't try to push or aggressively stimulate and triggering the cytokine, which is pro-inflammatory, and might risk in nodal formulations. Maybe that's my answer, Dr. Ruri.
Thank you, Dr. Stanley. So we have another question. This time it's for Dr. Jonathan. So it's from Dr. Ferry Ardiansa. He asking, so your patients demonstrated both tissue quality deterioration and structural volume loss. So Dr. Jonathan, in your decision making, what clinical or imaging parameters that determine when regenerative biostimulation alone is sufficient versus when you're using structural HA replacement? What do you think, Dr. Jonathan?
Thank you, Dr. Ferry, for very interesting question. Yeah, unfortunately, by today, there is no like strict protocol when we can use the stimulator, when we can use the hyaluronic acid. So until today, we basically use our clinical judgment. So yeah, I basically check the patient. If the patient has more skin related issues, so I will go with the biostimulation first. While if the patient still has a good skin quality, but has very severe volume loss, I would go for hyaluronic acid first. So yeah, unfortunately, until today, there is no strict protocol for this decision making. Thank you.
Thank you, Dr. Jonathan. Hope it answered Dr. Ferry's questions. So we have 2 minutes left. And maybe I just want to ask to Professor Reva and Dr. Stanley. So when you choosing between how you differentiate a product or a product or topical or active topical, how you differentiate those products between the marketing claim and the original science. How do you separate these both things when you choose new product or a new active in your perspective?
Okay. Can I go first? Okay, Dr. Rudy. First of all, as a consumer and also as a doctor, that we suggest this product to the patient, especially the new products, we have to see detail about the ingredients and also the claim of this product and the result is. And we can cross-check with maybe the literature. Sorry. About the function of the new ingredients, such as in the skincare products, they have a claim that the iron minerals can make enhance and sorry, yeah, can I continue? Yeah, okay. That can enhance the skin quality. The theory, it has a position. It has a benefit basically in the theory. So if we can try it on, and if we want to know the really precise the function of the products, we can check with the other tools such as a skin analyzer or the most objective from the parameters of the laboratory examination, I think.
Agree with Prof. Reva on this particular reason, Dr. Ruri. There are two attitudes that we need to always remind ourselves. First, we need to be always critics about the new development of technology, either it is topical or injectable or whatever that we can find in the aesthetic medicine field. First, we need to know that the very good product is always backed up with very scientific data, and there are another points that also supporting the safety profile and benefit and efficacy from the product itself. Secondly, at the same time, we have to always open our mind to the new innovation and embrace the development of any kind of technology, invention technology, and we're just covering topicals, injectables, or energy-based devices. So I guess that the balance between both attitude should be always in our response towards aesthetic medical field.
Thank you, Professor Reva. Thank you, Dr. Stanley, for your answer. So tonight we underlying the science and the clinical cases told the same story. We have the exposome-driven understanding of skin integrity, redefined skin quality, barrier restoration through ionic technology, and native type 1 collagen biostimulation. That alignment between mechanism and the clinical outcome is exactly what the evidence-based regenerative dermatology should look like. So that brings us to the end of a truly rich and thought-provoking scientific session. So I want to thank Professor Reva, Dr. Stanley, Dr. Jonathan, and Dr. Clinton for such generous sharing of knowledge and real clinical experience tonight. And to our audience, thank you for your engagement and wonderful questions. And I'll now hand it back to our MC, Dr. Andina, for the door prize and closing announcement. Thank you.
Guri, may I interrupt you for a second?
Okay. Thank you very much, Dr. Ruri, for leading tonight's scientific sessions, and to all our distinguished speakers and panelists for sharing such insightful presentations and engaging discussions. We truly appreciate the active participations of all colleagues throughout this webinar. Before we officially conclude this evening's event, it is now time for our door prize announcement. So 3 participants will each receive a premium skincare package from Interbat Aesthetics worth for 1.5 million Indonesian rupiah. Now we will announce the 2 lucky winners that already giving questions through the chat box from Zoom webinar and also live chat in YouTube. We will select it randomly by using a spin wheel. Okay. Can you spin the wheel, operator? Who will be the winner of the door prize? So the first name is Fauzia Z 4685. Okay, that is the first name. Congrats for Fauzia Z. And then the second winner, please spin the wheel again. Okay, congrats for Dwi Intan Yuniasih, who also got the skincare package from Interbat Aesthetics. So congrats for the both of the winner. But don't forget, we still have one chance to get the door prize because we still have one package that will be given to lucky participants who share their experience about Aruna webinar in Instagram story. So don't forget to tag at aruna.summit no later than 7 July or tomorrow. Now, if you enjoyed today's discussions, especially our regenerative decision room sessions, then you definitely don't want to miss Aruna International Summit. Why? Because what you've experienced tonight is only a warm-up for one of our most anticipated sessions at Aruna. We are proud to present pros and cons, a battleground of ideas, an exciting live clinical debate where experts from around the world will defend different evidence-based approaches in regenerative aesthetics. And then it's going to be chaired by one of our distinguished plenary speakers, Dr. Adriano Santorelli, a renowned plastic and reconstructive surgeon from Naples, Italy. This session will bring together international experts to debate the pros and cons of various regenerative treatment modalities. Through a dynamic pro versus cons discussion format, you'll gain insights into different clinical perspectives, evaluate the latest evidence, and even participate through live audience voting to determine the winning argument. So don't just learn, take a side. Join us at Aruna International Summit 2026 and experience one of our signature sessions firsthand. Now, I would like to remind you again that various exclusive opportunities are still available for webinar participants. For Indonesian participants, don't miss the exclusive Indonesian registrants offer valid until July 9, including registration promos for the symposium and workshop using the promo code available on the slide. Meanwhile, for international participants, there is an opportunity to obtain an international registration fee waiver through the exclusive webinar recognition, as well as to take part in the call for abstracts, with the abstract submission deadline of July 15. Complete information about all the programs, all the promos, and their terms has been shared via Instagram story at aruna.summit and can also be accessed by scanning the second announcement QR code available on the screen. Before we end tonight's event, I would like to thank once again to all speakers, moderator, panelists, participants, Aruna committee members for making tonight's webinar possible. We would also like to express our appreciation and gratitude to Interbat Aesthetic for their support and cooperation as the sponsor for tonight's Aruna pre-event webinar. So this webinar is the final pre-event webinar. The next time we meet each other is in Aruna International Summit. So we really look forward to seeing you there in Aruna International Summit, which will be held on September 4 to 6, 2026 in Jakarta. So this concludes tonight's webinar. Thank you, good evening, and see you at Aruna Summit.
What's new from Interpath Aesthetic? The first world's ionic skincare system.